One of the most common foot problems that we see in the front of the foot is a condition called Mortons Neuroma. Mortons Neuroma is basically a condition where the nerves that are located between these long metatarsal bones. These are the metatarsals, these long skinny bones. Of course, the toes are right above here. Looking at this plastic foot model, the nerves are not in here, but the nerve would be going right between this area, and the typical Mortons Neuroma is described basically between the third and the fourth metatarsal bone. There are conditions where, in some cases, people have neuromas between the second and third metatarsals also. I would say those are probably not as common, although I do see the second intermetatarsal space neuromas occasionally, and sometimes we even need to operate on them. So this would be the second intermetatarsal space. This is the first, very rare, probably extremely rare to have any kind of neuroma here, but the second interspace neuromas are a little bit more common, and of course the typical Mortons neuroma at the third intermetatarsal space is very common. The nerve forms like a Y-type shape. The central portion goes between these bones. Anywhere where these bones get narrow is a potential spot where the neuroma or the nerve itself can get pinched or entrapped. Where the nerve, there's also ligaments on the top and the bottom, which also can tighten down over the nerve. Over time, the nerve tends to swell and scar tissue starts to form in the nerve. People think of it as sort of a type of a tumor. It's not any sort of a very dangerous tumor, but typical Mortons neuroma is more or less a painful condition which causes numbness in the toes, numbness and tingling in the foot, mostly in the forefoot or in the front of the foot. Hurts quite a bit with walking. Sometimes people may even feel like there's a lump in the shoe. They may feel that the sock is bunched up. Generally, it's the burning, numbness, tingling, toes going numb, things like that, that we start to think that it could be a Mortons neuroma. So it's basically a swelling and a thickening of the nerve. There's scar tissue in and around the nerve fibers. Treatments are usually very simple treatments. Oftentimes we will look at the types of shoes that the patients are wearing and make adjustments in the shoes. The neuroma is actually more towards the bottom surface of the foot, and wearing either flip-flops or going barefoot, wearing hard sandals, or shoes with a very thin sole actually tend to aggravate the neuroma more. Wearing a thicker sole shoe, such as a good quality running shoe, is usually one of the things that I recommend to my patients first in terms of what treatments we can do. Other treatments could involve some sort of padding, using some sort of an insert in the shoe. We have custom orthotics, which are custom-made shoe inserts that support the arch, support the front of the foot, and take pressure off the neuroma. We also have some pre-made inserts that we use very commonly. Generally, those are the initial treatments we'll do for Mortons neuroma. We try that. If patients are having quite a lot of pain, then I may try an injection. An injection is usually a cortisone injection to reduce the swelling and the inflammation around the nerve. That will usually be very effective in terms of treating the pain. It may not be permanent. We tell patients it's usually not permanent, but people can actually get up to years of relief with an injection. Many people then come back and would want another injection. Well, we could do it at that point, which we usually will do. Very often, though, after the second or third injection, the injections become not quite as effective in treating neuromas in the foot. At that point, we could offer the patient surgery, which would involve actually removing a portion of the nerve. And with this type of surgery, it's usually very effective. Patients typically respond very well to the surgery. The surgery could be done from the top of the foot or the bottom of the foot. I would say, based on my experience of over 30 years of doing this surgery, that most of the surgeries that I've done, and certainly most that I've seen other people do or other people have coming to me from other doctors, were done from the top, where they're going from the top, trying to find the nerve, which is actually more located in the bottom. One of the reasons we try to stay away from cutting on the bottom of the foot is because we try to minimize the scarring on the bottom. If we create a scar on the bottom, that scar is going to be permanent. Patients are going to be walking on that scar, and it would be not very advantageous to create a scar on the bottom of the foot and have that become painful, which is possible. So for the most part, we try to do the surgeries from the top of the foot. When I do the surgery, I try to take out enough of the nerve so that there's no chance or very little chance that the nerve could grow back. Nerves do try to grow back. It has to be taken out appropriately to try to minimize the possibility of the nerve reconnecting and forming another neuroma. The surgeries typically are highly successful and involve a period of rest and bandaging. During that time, I'll try to keep people off the foot as much as possible to allow it to heal as quickly as possible. Obviously, people want to get back to their lives and get back to their jobs, get back to their families, get back to their normal activities, but after a surgery, it makes sense to just take it easy and let the surgery heal up as best as it can. Once the surgery is healed, we progress the patients to back into their normal shoes, back into their normal activity level, and we usually would recommend some sort of an insert or orthotic at that point to just give them more support and try to make it more comfortable for them to walk. If you have any questions, any further questions regarding neuroma or any other conditions of the foot or ankle, please feel free to call our office at the number below.